Hello, my friend. This is Dr. James, a physician with over 30 years of experience, exclusively dedicated to men's health after 60. I need to ask you a question, with complete honesty. Have you stopped waking up with morning erections that used to be so natural? Do you feel your sexual desire slowly fading, along with your energy and confidence? If your answer is yes, please don't assume this is normal for your age, because it isn't. Science has already made this clear. Research from the Mayo Clinic has shown that the absence of spontaneous erections at night and upon waking is directly linked to circulatory and neurological system impairments. This means that when these erections disappear, it's not your desire that is weak, but your health that is asking for help. That's why today I need you to listen very carefully to what I'm about to tell you, because everything, absolutely everything, can start to change with what you do before bed. Yes, it sounds simple, but it's not. If you ignore this crucial moment, your body will gradually disconnect from your true male potential. And believe me, this has nothing to do with age. It's about hidden habits that most men unknowingly practice, which ultimately steal firmness, desire, and potency over the years. So, stay with me until the end, because I will reveal what's truly behind all of this. Most importantly, I'll show you what you can start doing today to change this course. Before we continue, please tell me in the comments how old you are and where you're listening from. I want to know who is with me on this journey. Let's take care of your potency together, with respect, science, and dignity. Let's begin. Now that you understand the importance of what happens before bed, let me tell you what occurs during your sleep. It's during this time that your body can decline from within without you even noticing it. During the deepest phase of sleep, known as REM sleep, your body activates vital regenerative processes. One of these processes is the natural production of spontaneous erections during sleep, even if you are not engaging in sexual activity. Yes, this happens 3 to 5 times a night, completely involuntarily, and it's no accident. Your body does this as a form of internal exercise to maintain the health of your penile tissues, ensuring they receive oxygen, blood supply, and sensitivity. These nocturnal erections are a signal that everything is functioning normally. But when they disappear, and many men don't even notice this happening, the risk begins to rise. Blood flow decreases, the elasticity of the corpus cavernosum weakens, and the tissue starts to atrophy. Over time, this can lead to persistent erectile dysfunction, even without obvious symptoms at first. A study published in the Journal of Sexual Medicine showed that the absence of nocturnal erections is one of the first signs of vascular impairment in older men. This means your penis acts as a silent thermometer for your health, starting to sound alarm bells long before other symptoms appear. Therefore, my friend, what happens during sleep is far more critical than it seems. If you are not getting proper rest, if you are not entering REM sleep, or if you are blocking this process with harmful habits, your body shuts down essential functions without warning you. By the time you notice it, you're no longer waking up with the same firmness you once had. But don't worry. The good news is that this can be reversed. In the next segment, I will show you exactly what to do before bed to protect and even restore this natural potency. But before we continue, please tell me in the comments, do you wake up with morning erections? How often? Write yes, rarely, or never below. This will help me understand the state of your health and that of many other men reading this with you. Now that you understand what happens to your body during sleep, it's time to take action. And it all begins with your evening routine. There's no point in going to bed early if you're engaging in habits that prevent your body from recovering properly. So, let me show you what you can start doing tonight to protect and perhaps even restore your potency. First, aim for at least 7 hours of sleep per night. Men who sleep less than 6 hours have 30% less testosterone, according to research published in the Journal of the American Medical Association. Without adequate testosterone, there's no desire, no energy, and certainly no firm erections. Second, drink a glass of warm water or a natural herbal infusion before bed. Dehydration thickens the blood, impairs circulation, and can cause micro damage to erectile tissues. Ginger tea, cinnamon tea, or a homemade lemon drink are excellent choices. Third, perform a simple yet powerful breathing exercise. Inhale through your nose, counting to 4. Hold your breath for another 4 seconds. Slowly exhale through your mouth, counting to 6. Repeat this 5 times. This activates your body's recovery system and significantly improves circulation in the intimate area. Fourth, turn off all screens at least an hour before bedtime. Your phone, television, tablet, they all emit blue light, which blocks melatonin, the hormone for deep sleep. Without melatonin, you won't enter REM sleep, and then nocturnal erections simply stop occurring. Fifth, avoid sweets and alcohol in the evening. They might seem harmless, but they reduce the production of nitric oxide, a key molecule for erections, and they also cause inflammation and hormonal imbalance. At night, your body needs to rest, not be busy digesting. Finally, don't go to bed immediately after eating. Allow at least a 3-hour gap between dinner and sleep. This way, your body can dedicate itself to regeneration rather than being solely occupied with digestion. You see how simple these actions are? Yet, when performed consistently, they protect what many men consider lost forever: natural masculinity, firmness, and the pleasure of feeling alive. Now that you know what to do in the evening, let me show you what to do in the morning during the first 5 minutes of your day. Because yes, what you do right after waking up can determine whether you have a day full of energy and confidence, or a sluggish day, lacking desire, and with weak erections. To begin, your penis needs movement. Not just sexual movement, but physical, muscular, and vascular movement. Circulation is everything. Without blood, there's no firmness. Without firmness, there's no potency. So, here are 3 exercises I recommend to all my patients over 60 every single day. I want you to perform them in the exact sequence I'm about to show you. Exercise 1. Marching in place. The pelvic pump. Stand straight, arms hanging loosely, and begin to bend your legs as if marching in place. Lift one leg at a time, alternating, as if you want to touch your stomach with your knee. Do this for 1 continuous minute. This simple exercise activates circulation in the lower body, stimulates the lower abdominal muscles, and directs blood straight to the intimate area. It's one of the most effective ways to reactivate your penis in the morning effortlessly, without medication, just using your body. Exercise 2. Nitric oxide breathing. Natural vasodilation. Sit with a straight back, or you can even do this while lying in bed. Inhale deeply through your nose for 4 seconds. Hold your breath for 4 seconds. Slowly exhale through your mouth for 6 seconds. Rest for 2 seconds and repeat 6 times. This pattern boosts the production of nitric oxide, the molecule necessary for penile blood vessels to expand and allow blood to circulate powerfully. Additionally, this breathing reduces sexual anxiety and improves performance during intimate moments. Exercise 3. PC muscle contraction, the control center. Now it's time to activate your most important muscle for sexual life. The pubococcygeus muscle, also known as the PC muscle. This is the same muscle you would use to stop the flow of urine midstream. Contract this muscle, hold for 3 seconds, and release. Repeat 10 times. This exercise strengthens control over erection and ejaculation, improves firmness, and also protects the prostate. You can do it standing, sitting, or even lying down, right after waking up. Best of all, no one will notice. You can even do it in the shower or while brushing your teeth. Now, listen carefully, because this is where many men get lost, even when they're already doing everything right. You might be sleeping well, doing your morning exercises, watching your diet, but still feel that your firmness, desire, and performance are weakening. If so, it's likely you're making one, two, or even all three of the mistakes I'm about to reveal. I'll start with the most ignored mistake of all, which destroys everything, starting from the mind. First, believing that sex ends with age. This thought is more common than you think. I'm already over 60, I'm too old for that. I don't have a partner. Why bother thinking about it? That's for young people. Such ideas, even if not spoken aloud, kill desire from within. Your body still produces testosterone, still responds to stimulation, still feels desire. But if the mind gives up, the body obeys. It's like turning off a light that still works, simply because you've decided it's no longer needed. What to do? Talk about it. Address this topic naturally. Reconnect with your body even without a partner. Conscious touch, massages, self-care, self-affection. Don't extinguish the fire just because there's no fireplace. Sometimes, all that's missing is determination. Second, spending hours sitting without moving. This is one of the worst saboteurs of male circulation. After 60, many men spend most of their time sitting, in front of the TV, in the car, on the couch, at a desk, in bed. This compresses the pelvic area, hinders blood flow, and atrophies the vessels that supply the penis. Even with good nutrition or adequate sleep, this physical blockage is enough to subtly weaken erections. What to do? Simply stand up every 30-45 minutes. Walk around a bit, do some light squats, stretch your legs, and breathe deeply. If you can, use an ergonomic chair that doesn't put pressure on the perineal area. Movement is circulation, and without circulation, erections don't exist. Third, using alcohol as a nighttime sedative. Just a glass of wine just to sleep better. That's how it starts. Alcohol might make you fall asleep faster, but it blocks REM sleep, where spontaneous erections and testosterone production occur. Furthermore, it reduces penile sensitivity, disrupts the nervous system, and diminishes blood flow. Worse, it trains your body to live disconnected, without desire, without potency. The solution: replace alcohol with relaxing nighttime infusions, such as ginger turmeric tea, warm water with lemon, or mild herbs like chamomile or mulungu. Your body will thank you, and your erections will too. If you felt that this content opened your eyes, if something here made sense to you, touched you, or made you remember how you felt, then please don't keep it to yourself. To keep such information to yourself is almost like seeing a friend drowning and not throwing them a rope. You know how much these topics are still fraught with silence, shame, and taboos. But the truth is that millions of men are losing their potency, joy, and even relationships due to a lack of guidance. And the saddest part is that most could reverse this with simple steps, if only they knew where to begin. Therefore, I ask you now, with all due respect and without circumlocution, share this video with at least one man you respect. It could be your father, brother, colleague, or that friend who would never ask you for help, but would be grateful that this information reached him. If you want to continue this journey of reclaiming your natural male potential and receive more science-backed advice on male health after 60, subscribe to the channel now. The more men reached, the more dignity we restore. This is not about vanity. It's about health. It's about life. Thank you for being here.